So I think the new aspirin guidelines are very important. I think they are timely. I think there has been a lot of recent data that has come out that has, in my opinion, reinforced a lot of the prior data. I think there's a lot of miscommunication when it comes to aspirin. I think people see aspirin as a panacea, as a miracle drug, that it is something you can just pop into your mouth and it does miracles. And I think what these guidelines do is they remind us that there are good things for aspirin and there are not such good things. For example, aspirin should not be used by everyone for the prevention of a heart attack or stroke. Okay? However, those that have established cardiovascular disease, somebody who had a prior heart attack, a prior stent, a prior stroke, aspirin is without a doubt a staple, which means it is very helpful in preventing heart attack, stroke, and death. But the question becomes, who should be taking aspirin for the prevention of a first heart attack or stroke? And I think one has to remember that there is some data that supports its use, but it has to be balanced against its potential risk, right? So that it's not a free lunch. It's not a drug that you take without side effects. There are very serious side effects, serious bleeding, both in the GI system as well as in the brain. So really you have to really think about whose benefit outweighs the risk. So in my opinion, the new guidelines reinforce this benefit versus risk component. It states that there are certain individuals who may benefit from aspirin, but you want to make sure that their benefit outweighs the risk. And there are certain individuals where the risk may outweigh the benefit. For example, in older individuals above the age of 70 or so, there was no compelling benefit in the most recent trial, and there was significant risk. So the guidelines remind us that in populations where the benefit does not outweigh the risk, perhaps you should be holding off.